Hi, I'm Dr. Saravana Kumar. I'm a consultant gastroenterologist and a liver specialist at Park City Medical Center. Today we're going to talk about hepatitis. So before we delve further, let me tell you what is hepatitis. Hepa means liver and titis means inflammation. So it means inflammation of your liver. There are many causes for the inflammation of your liver, and today we're going to talk about hepatitis B and hepatitis C. It's very common in Malaysia. Incidence of Hep B is around 5% among the population in Malaysia, and the incidence of Hep C is about 1.5%. Okay, the risk factors for hepatitis B and C, there are few risk factors why one is more prone to getting them. If your mother is infected with hepatitis B or C, then during delivery there is a risk of her transmitting it to you just during delivery or shortly after delivery. That is the commonest route of transmission for hepatitis B in Malaysia. The other risk factors are including if you have sexual contact with someone infected with Hep B or Hep C, unprotected sex with them, it also can give rise to Hep B or Hep C in the other individual. If you share needles that are not sterilized and for recreational drug usage, tattoos, for acupuncture, then there is also a risk of you getting Hep B and Hep C if the needle has blood tainted with Hep B and Hep C virus. If you had organ donation, organ transplants, blood donations, plasma factors given to you before, then you are at risk of Hep B and Hep C, especially if you had it in the years before 1990s because they never had screened them for the blood products for hepatitis B and C then. These are one of the common risk factors for hepatitis B and C transmission. Symptoms for hepatitis B and C, when you first get it, you might not even know you have got Hep B and Hep C. It can just present like a normal cough and cold. You probably think you have a viral infection and it settles on its own. Sometimes they can present with a very bad inflammation to your liver, causing acute liver damage and failure, which can be fatal as well. Or over the years, hepatitis B and C can cause recurrent damage to your liver, leading to liver cirrhosis, or in common terms we call liver hardening. This can compromise the function of your liver, and you can present with various signs and symptoms, including you can become jaundice, you can have fluid accumulation around your tummy, you might look like a pregnant lady, a man can look like a pregnant lady, might have leg swelling, you might even have vomiting blood, or you can present with this kind of symptoms. These are normally quite late already. There's a lot of damage being done. You also will be have a risk for developing liver cancer as well. Hep B and Hep C is a risk factor for liver cancer as well. So you can present initially to the doctor after having Hep B and Hep C for many years with liver cancer as well. So these are the common ways patients can present with Hep B and Hep C. So it's good to screen yourself with blood tests to check whether you have Hep B and Hep C if you have any of the risk factors I mentioned earlier, because there's treatment available for Hep B and Hep C. There's tablets readily available for Hep B which can suppress your virus and reduce complications that can occur due to Hep B. And there's medication that you can take for Hep C which is in tablet form that can also eradicate Hep C. These are very new advanced medication that's available in Malaysia now. Vaccine is the best prevention for hepatitis B because there's a vaccine available for Hep B. It's given for all children born in Malaysia over the recent years. Those who are much older, they can check their blood, and if they have no Hep B and they have no antibody towards Hep B, it's good to get themselves vaccinated. It's 3 shots over a period of 6 months. Also, try not to get tattoos, body piercings, acupuncture with infected needles. Make sure the needles are clear or you have newly needles being used. If you are in close contact with someone who's infected with hepatitis B or C, do not get into contact with blood or bodily fluids that can transmit Hep B and Hep C if you come in contact with them to break in your skin or through your eyes or through your mouth. If you have a sexual contact with someone with Hep B and Hep C, then it's always better to have protected sex. Or if you have Hep B, it's better to get a vaccine so that you have less chance or no chance of getting Hep B from the infected partner. These are the common ways of prevention. Also, do not share razors, toothbrush, combs, anything with blood inside from an infected person to avoid or to reduce the risk of getting Hep B and Hep C. Screening for hepatitis B and C is easily done with blood tests. Simple blood tests, you can have it done at any lab, or you can come to our Park City Medical Center. It's easily done. You need to inform the doctor that you want to screen for hepatitis B and C. And once we do that, if the test become positive in any way, then you need to see someone like me, who's a liver specialist, to do further tests to see whether you need treatment for hepatitis B and C. You will need ultrasound, you will need blood tests to check your viral loads and see whether you need tablets. So if you pick them up early, you can prevent complications of liver cirrhosis, which I mentioned, and also reduce the risk of you getting liver cancer in the future, so you can lead a normal life, and also prevent the transmission of these viruses to your other family members, as you will be aware that you have it and what you need to do to prevent it from transmitting among your family members and friends as well. Okay, so we've only got one liver, so you need to take good care of yourself and your liver. So if you've got any risk factors I mentioned earlier for Hep B and Hep C, do screen yourself so that your liver is protected.